Today on Snowwalker Bushcraft, we're going to talk about the CAT tourniquet, which is Combat Application Tourniquet. Don't go away. So here we have the Combat Application Tourniquet. Okay, this is known as the CAT tourniquet, and it's one of the tourniquets that I have trained with, and it is the tourniquet that has been provided to our guys while they're in the sandbox in the military. This is what's in their blowout kit. This is an earlier model right here, which I do use, and there are some differences between this generation and this generation, and now they are up to a Gen 7. Let's look at the more modern one, because that's probably the one that you are going to get. When you get it, it is packaged just like this. It needs to be taken out. You need to read the instructions. You also should be trained to use a tourniquet properly before you actually apply one. Again, make sure you go out and get trained on how to use a tourniquet. Just watching a video, and I hold absolutely no responsibility whatsoever for you administering a tourniquet without the proper training. So, that being said, here we are. We're going to open this up. And what's in here? We have an instruction sheet. Tells you exactly how to put this on for one-handed use, and then it tells you how to store it for one-handed use as well. Be advised that they do come in orange and they do come in trainer blue. So you will see here that you have a red pull tab, and that's important because when we actually apply this tourniquet, you want this towards the heart. You have a windlass, which is right here, which is what's going to tighten the tourniquet itself. You'll have a time marker. You would write the time that the tourniquet was applied to the individual, your patient or yourself. When we set this up to use for one-handed, now, on some of the older models, they did not have these little teeth in this buckle, and the buckle was even smaller. It was not as robust, it was not as thick. However, this would be set up to use if it was going onto a leg. If you use it onto a leg, that they would go ahead and they would set this up and put it in the second slot. You can, for one-handed operation to the arm, you can slide it in there into the first slot. Okay? We come out about 6 to 8 inches and we put our Velcro on there. Now, we fold this in half. We take our time stamp and we put this over the top. We don't want anything in the way of the windlass. This is now ready to apply for a one-handed application. What we're going to do, we have this set up for one-handed operation. So, we open it. There's our red tab towards the heart. Put this on. Put the tourniquet between the wound and the heart. Okay, so always above it. So go up high on the arm, as high as we can go, and we cinch this off. Take our windlass. We're going to turn this until the flow of blood stops. We clip it right here. Over the top, and we're good to go. That would be in the arm. Right, our time. Something about a tourniquet, safety tip. They used to tell you, unloosen it every 15 minutes. We don't do that. Once the tourniquet is in place, we do not take it off. The doctor or higher ranking medical official will take that tourniquet off and deem when it needs to come off under a controlled atmosphere. Same thing, leg application. Say our wound is here. All right, always come up at least 2 to 3 inches higher than where the wound is. If this artery is severed, sometimes it actually retracts up into the body. Okay, say this is a traumatic amputation as well. The body goes into healing itself. Again, that artery may retract up in. So this time we are going to have to go to our second loop. Okay, first one, second one, same thing. Again, use our windlass, turn it to the point where it stops. The blood flow, write our time, do not remove it. Okay, so that's the combat application tourniquet. Again, you know, watching a YouTube video is not a replacement for going out and getting trained on how to apply a tourniquet and use it correctly, and being able to take care of yourself or somebody else, your family member, or just somebody in the woods. Take a first aid course, take a wilderness first aid course. Do what you can to help yourself, help your family, and help others. It's Brian from Snowwalker Bushcraft. Thank you for your views and your comments. Until the next one, walk the woods.